Hello, my name is Amirta Narain, and I am a baccalaureate student in nursing 4580, Synthesis of Professional Nursing, and this is my capstone project. This is my professional bio sketch page. Here you can see that I was born in Trinidad and moved to Houston, Texas in 1995. I'm the youngest of three siblings and married with two children. I'm currently a cardiac nurse at National Cardiovascular Partners in an outpatient ambulatory center since 2008. My first position as a nurse was at Memorial Hermann Hospital in a catheterization lab from 2004 to 2007. I received my ADN degree in nursing in 2004 from San Jacinto College and a BS degree in biology with a minor in chemistry in 1999 from the University of Houston. I passed my NCLEX exam in the summer of 2004. I'm currently pursuing my Baccalaureate of Science degree in nursing. As a registered nurse of 13 years, I am extremely dedicated to advocating and enhancing the care of cardiac patients. I'm very passionate about providing holistic care to all patients. The first student learning outcome from the undergraduate student handbook is Humanity and Society, which practices safe and effective holistic patient care to a variety of patients in multiple settings from a global perspective by incorporating theories and evidence-based findings. I felt like this student learning outcome was addressed in Nursing 4550, Care of Communities. The first assignment, epidemiology exercise, allows care to be focused on an 11-year-old student. The second assignment, the at-risk special population assignment, focuses on care of patients in multiple settings from a global perspective. The third assignment, global health discussion, which focuses on global issues and evidence-based findings, were incorporated. This outcome was also addressed in Nursing 4550, Nursing and the Healthcare Environment. The Global Health PowerPoint presentation helped to gain a better understanding of the role of a professional nurse in a global perspective. By performing these assignments, I felt the outcomes were met 100%. The second student learning outcome, Lifespan Health Continuum, supports patients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. Evaluates patient-centered care for patients, clients across the lifespan based on common and complex health needs, and compromise multiple health states when considering multiple determinants of health. This outcome was addressed in Nursing 4620, Care of Patients with Compromised Multiple Health States. Discussion 3, Care of Cardiac, Renal, Pulmonary Compromised States. Discussion 4, Care of Patients with Compromised Neuroendocrine GI Conditions. Discussion 5, Care of Patients with Trauma, Compromised Immunity, and End of Life. Practicum Reflections 1 to 4 talked about evidence-based care and theory-based advocacy for compromised patients. This outcome was also addressed in Nursing 4316, Comprehensive Holistic Health Assessment, emphasizes the assessment phase of the nursing process across the lifespan. A series of assessments were performed on a simulated patient to identify health promotion, risk assessment, and disease prevention behavior. Assignment included the systems assessment in Shadow Health patient Tina. By performing these assignments, the outcomes were met 100%. The third student learning outcome was evidence-based practice in clinical reasoning, which synthesizes clinical reasoning and judgment in nursing practice, utilizing critical thinking, nursing process, research, and evidence-based practice. This outcome was addressed in Nursing 4580, Synthesis of Professional Nursing. The various discussion boards on Baby William, the Lewis Blackman story, and the practice project with theory. addressed in Nursing 4390 also, Nursing Inquiry and Evidence-Based Practice. The quantitative research article assignment, which talked about nurses' pain management for hospitalized elderly patients with postoperative pain. Discussion 1, Ethics in Nursing Research. Discussion 2, Qualitative Research. By performing these assignments, the outcomes were met 100%. The fourth student learning outcome is patient-client-centered care, which employs safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patients and members of the interprofessional and intra-professional healthcare team. This outcome was addressed in Nursing 4550, Leadership and Management in the Healthcare System. The clinical application assignment focused on handoff communication and patient-centered care. The effective leadership and quality assignment. Module 4, discussion board on healthcare delivery in various scenarios and providing culturally competent care to all patients. By performing these assignments, the outcomes were met 100%. The fifth and final student learning outcome is the professional roles construct. This differentiates multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients as a member of the interprofessional and intra-professional healthcare team. Demonstrates professional integrity, effective communication, active inquiry, and service to the community. This outcome was addressed in Nursing 4321, Theories in Online Education, Module 4, Ethical Issues, a discussion on change and paradigm cases. Also, this outcome was addressed in Nursing 4550, Leadership and Management in Healthcare System, Healthcare Delivery and Providing Culturally Sensitive Care that covers the ethical, legal, and regulatory parameters. And finally, I believe that this outcome was addressed in Nursing 4540, Care of Communities, Practicum Project Disaster Preparedness, presented disaster preparedness to teaching to a woman's shelter. By performing these assignments, the outcomes were met 100%. My personal 5-year career plan is to gain experience through training and volunteering, to join a professional organization to better serve the community, to obtain a master's degree in nursing, and to eventually become a nurse practitioner in women's health. According to the Nurse Practitioner in Women's Health organization, I would like to follow their values, which would be to increase women's wellness and health outcomes and decrease health disparities affecting women, to collaborate with transdisciplinary teams to ensure comprehensive client-centered care and high-level patient satisfaction, to increase the knowledge, skills, and clinical competence of women's healthcare providers, to mentor and support the next generation of women's healthcare nurse practitioners. And this is my reference page. Thank you so much.